We do know that for patients finishing cancer treatment, the levels of obesity is quite similar to the obesity in the young person population that didn't have therapy. So we know it's an issue for everybody. We also do know that for specific cancer therapies, there is some evidence that suggests that definitely that high energy, high fat intake during therapy, so that education around that can actually cause unintentional or unintended weight gain after therapy. So we know that that's not a good scenario. So I guess it does really raise the awareness that us as a cancer community need to be wary that the messages we give to patients on treatment are that they are known, that they're very specific to the on treatment and the recovery setting and not the survivorship phase, because we know that the messages in the survivorship phase are different and they're more in line, or they are in line, I guess, with the regular healthy diet for Australians education that we all should be following, and most of us are really, not doing a great job in that particular area. In terms of the overall evidence, for guiding our diet practice in cancer therapy, we have had a lot of, a lot of new studies that have come out in really the last decade that shows that there is a great deal of evidence for the work of the dietitian working with patients during treatment. So in terms of the specific messages, I guess we just have stronger evidence that suggests that maintaining weight and getting enough energy and enough protein is very, very important. In terms of the delivery of that particular message, I guess, and from working with patients, it can often be interpreted that, oh, okay, I've got to eat more calories, that means I can eat anything and everything. And that's really not the message that dietitians are putting out there. Dietitians will work with a patient to maximise the foods that they can eat. Now, for example, if a patient is really struggling with their eating and drinking, we might be focusing on some really high calorie foods that absolutely are not in line with healthy eating recommendations. And that's okay, because those healthy eating recommendations are actually developed for well people. They're not specific to cancer patients. So that might be a time when a patient, if all they can eat is some KFC chicken and some potato and gravy, that might be a time where we go, okay, well, that's better than nothing. But in terms of the consistency of keeping up with those recommendations after treatment, it is an absolute no-no. And I think as a profession, we need to be a lot better with meeting with patients after they finish treatment and following up on those recommendations and helping them transition back into normal healthy eating, and keeping an eye on what is going on with their weight after treatment has finished.